A doctor is in the middle of treating her patient. Patient Jack suddenly grabbed the female doctor by the neck. Fortunately, security rushes in just in the nick of time. It takes both of them to finally pin him down and restrain him. Thankfully, Martha isn't seriously hurt. House claims the guy is having a psychotic break, and considering his previous back pain, he suspects Jack is suffering from nerve damage caused by syphilis. Kevin points out that they already screened him for that, and the results came back negative. Then, it suddenly occurs to Martha that the person poisoning him might be one of those recruits he's been tormenting at the boot camp. So, Kevin and Martha go straight to Chris, the recruit Jack always picks on, but he denies it, insisting he never poisoned Jack. Kevin gets aggressive and tries to threaten him into talking. He warns him that if he doesn't confess to the poisoning, they won't be able to treat Jack, and if Jack dies, Chris could be looking at a second-degree murder charge. But Chris looks completely unfazed and says he doesn't have any parents anyway, so winding up in prison was just a matter of time. Back at the hospital, the team has no choice but to give Jack an antidote. Jack wakes up and starts apologizing to Martha. But before he can even finish, Jack suddenly starts gasping for air, and his monitors start blaring alarms. They see his heart rate spiking to 180. Kevin immediately orders Martha to push meds to lower his heart rate. The next day, everyone's pagers go off at the same time. To their surprise, Chris has come down with the exact same symptoms as Jack. The doctors ask them if they've shared anything or used the same items, but they both say no. In fact, the moment they see each other, they start arguing like mortal enemies. Afterwards, House orders the team to treat them for Lyme disease. Suddenly, they hear Jack screaming in pain. Jack cries out that the muscles in his leg feel like they're being crushed in a vice. They immediately sedate him. After running some checks, they discover that the leg pain was triggered by kidney failure, which caused severe hyponatremia. And it turns out the Lyme disease treatment was completely ineffective. They investigate further and learn that Chris is different from the other guys in the camp. The others were sent there after committing crimes. But Chris just shoplifted a bag of snacks, which is hardly enough to warrant a sentence. Yet a social worker had him sent there anyway. Martha immediately questions House about this. He explains that someone paid to have Chris put in that camp. At that moment, House seems to figure something out. Shortly after, House has Martha and another nurse pretend they need to run tests on Chris, and they will him out of the room, bed and all. Meanwhile, sits right down by Jack's bedside, watching as Chris is wheeled away. House reveals he contacted the boot camp and found out that Chris's fees were actually being paid by Jack. And based on his deduction, Jack is likely Chris' father, whom he has never met. Jack silently admits to it, but he begs House not to tell Chris about it just yet, now that they've established the father-son connection. House realizes they're likely dealing with a genetic condition. Martha quickly switches their meds, and the plan is to perform a liver transplant to treat them both.